Hi, Shay. Thank you for having me on.
This is so great. Thanks for taking out your time. I know you've been so busy. I see all of your posts and all the things that you're doing, and I can't wait to talk to you about all those things. So thanks so much for taking time out in your day. So listen, do you mind introducing my audience to you and what you do, and we'll go into our conversation today.
Yeah, so my name is Dr. Rajka. That's how I'm known clinically. And so I'm a traditionally trained functional or family medicine doctor that very soon found that I wasn't able to cure pretty much anything that came through the doors. I know we all laugh, right?
Right.
And I got kind of disenchanted with medicine, was always seeking, and it was so funny, and we'll get to how we know each other. But it was through being an expat and trying to provide better advice, medical advice in a country that I felt was up and coming, but not quite there with medical advice. I found the field of functional medicine, and it described really the process in getting people back to optimal health. And little did I know that I found it just in time, because I had my health downward spiral as I was moving back to the United States to get into my first job. And with the help of another functional medicine doctor, I was able to recover it, much to the surprise of the gastroenterologist. So I had one autoimmune disease, and they were entertaining a second. Yeah, so it was huge.
Wow.
Because, yeah, I know. And it was subject me to a lifelong of steroids. And when I tried to propose to the traditional gastroenterologist that that look, isn't this great? My numbers are all normal now. And guess how I did it? Like the minute I said diet, their ears just closed. And lifestyle. So all the profound changes I made.
Wow. So do you currently have an autoimmune disease or?
Well, we call it, you're always going to have it. So as far as they were entertaining autoimmune hepatitis, and the mortality rate is 50% if you're not on steroids in 3 to 5 years. So it was, and so
wow.
This happened in 2013, and we're 7 years out. So, and I've had normal liver function since. So clearly never got that diagnosis and haven't been on steroids. The second one is Hashimoto's thyroiditis. So they did catch that. That was caught after a decade. And so after a while, your thyroid gland does burn out. So I am maintained on medications, but I really wish I would have known way back in my 20s.
Yeah.
Now.
Yeah. Of course. So you've had it all this time.
I had it for a decade, and it really is kind of my why story of, being so fatigued all the time. And you think it's normal because in residency and medical school, you're supposed to be tired, but it was pretty funny. Like I got made fun of for falling asleep standing up. I fell asleep at a rock concert. So yeah, so that's profound.
I'm sorry, that's hilarious.
I fell asleep on a date. Can you imagine how exciting I was as someone's date back then?
Right. Oh my goodness. I love that story. Well, you look beautiful, and we're happy that you're here and that you're all healthy and safe and all that kind of good stuff. So kudos for you for, being your own doctor, being your own MD. That is, kind of was the case. You kind of feel that way as a parent, that you are their, personal MD. And then we have to do that for ourselves as well. Yeah. So, Dr. Rajka, we know each other from living overseas and being expat moms. I mean, before you are all those other things, you are a mom. And so we met because our kids shared a classroom, and I think twice, and did the Doha Moms Together, which was an expat mom group. And so really spent a lot of time. And honestly, until you left, I didn't even know you were an MD. Someone mentioned it, and I think we had a conversation about me giving birth in the Middle East. You might not even remember that conversation. But I was really hesitant. We were trying to do some family planning, and someone mentioned you were a doctor, and me and you had this conversation. So thank you for the free consultation.
My pleasure. And that's what got the entrepreneurial ball rolling, was seeing an unmet need as an expatriate, of seeing really bad medical advice being doled out over and over again. So Expat Dr. Mom was as a result of trying to provide kind of free guidance. So I wasn't diagnosing or treating, but I met with many people like you, and I did end up giving birth abroad to Livy. So I think you might remember that. And so, and had a great experience, but I had to trust in that I found great providers, and I had the knowledge that some people don't. So
Yeah, I mean, I had my second child there in Doha. I was very apprehensive. I was very fearful. And through you and other moms who had given birth overseas, I felt a little better, honestly. But, as time went on, honestly, giving birth there was a bit of a blessing because I had so many friends stateside that had other complications and other issues. That had nothing to do with their own personal pregnancy, but just the care and the bedside manner here in the U.S. So I felt like that was kind of compelling, that I was afraid of them, but this is kind of a better place for me,
Yeah.
Anyway, Maya is our Middle Eastern human souvenir. That's what we like to call her. We brought her home. And so I kind of want to talk to you before we get started. Tell us about, because connections, I mean, us having this conversation here is really all about us having a relationship, us having a connection, and really, just reconnecting. Like, hey, Rajka, do you mind being on my podcast? I know you're busy. And you just responding and just, supporting women like you always do. And I really appreciate that. But can you tell us a bit about how relationships have been important to you in your career and how you've been able to maneuver?
Yeah, they are at the crux and the hallmark of any good business and businesswoman. So, and just in general, say that you're just a mom. I mean, the things happen, and I just feel very blessed and fortunate, and especially during COVID-19, where a lot of us who were in person then had to pivot and change our businesses and had business fall off to almost zero for a short period of time and say, what are we going to do? And it was really with having these strong connections to say, okay, what are we cumulatively going to do as a group? I had so many practitioners I was in contact with that we came together in several of the groups and had Zoom lives until we all felt stabilized. And it was so powerful to have those connections. And someone once asked me, like, well, what's your list size? And I said, that's not the right question. The question is, what is my influence? What is the list of my cumulative network? That's where the power is.
Wow.
And they were astounded. And then so it was to get on earlier, before I had built up a list, to get onto a summit. And at the end of the day, this person thanked me and said, wow, you had the highest number of registrations from your list. And it wasn't just my list, it was a cumulative list. So
no, that's great. No, I'm always trying to draw the connection to, your network, you having relationships with individuals, people understanding you and trusting you to help them with their career. So I love to kind of start off the conversation. Now, for those who were, in the beginning of their career, in the beginning of their journey, did you always want to be a medical doctor? Was that always the plan? And how did you make this decision to go to medical school?
Yeah, that's a great question. So I did. I had a dream since I was 5 to be a doctor. I just couldn't, at that young age, my mind couldn't see the importance of any other profession. And I'm not certain where that came in. It was like almost this internal fire and drive. And as you've seen, I don't do traditional medicine anymore. So while I can fall back and rely on it when it's needed and guide people, but so I've pivoted and changed several times and have really enjoyed it. But yeah, I did know. And so it was helpful in staying on purpose and on task. And that's why I would say is for medicine, regardless of what type you go in, and I'd love to persuade any future doctors to become functional medicine doctors, is if you really have to want it. The from A to Z to become a doctor, there's so many challenges, and it's not an easy road. And there's a lot of sacrifices that happen that I don't think people know. Your formative years, the mounting debt that you come out with, feeling financially strapped for a long time. I mean, there's all of that. So you really have to want it.
Yeah, I think mostly we hear about the debt, right? That's what you hear most.
Yeah.
We hear that most. So can you explain what the difference between, your modern everyday medicine, traditional medicine versus functional medicine?
So traditional medicine we call allopathic medicine, and that's pretty much to prescribe. So it's basically someone comes in, I'm going to give you an example of a headache, and says, I have this headache behind one eye, it makes me sensitive to light, I vomit, and I have to sleep it off for 3 to 4 days. And the doctor says, oh, that's a classic migraine. Here are some migraine meds. Take them when the next one comes. And so what I do is I come in and I look at what triggered that migraine. So we do offer temporizing solutions till we can find the trigger. And usually the triggers are things that cause inflammation in the body. And there's 8 things I think of. I think of sleep and stress and toxins and foods and infections. So an imbalance in bacteria in your large intestine, which we definitely can't cover here, but that's
right.
The microbiome and nutrients being depleted. So the perfect example of nutrients being depleted is we used to give in a former clinic I was at IV magnesium, and we could stop someone's headache because most people are magnesium deficient. So you have to bring them back into balance, and you figure out maybe they're not sleeping. And so in traditional medicine, I was able to discern that a lot of people were dehydrated and maybe sleep was a factor, but I didn't know any of these other factors that were at play. And so it's really saying, how can I restore balance without having to give you medicine? So it's really treating the cause rather than slapping drugs at the end symptom or disease.
Wow. So were you a traditional medical doctor prior to going overseas? And then you returned with a new awakening with this functional, more, global mindset?
That's a great question. So yes, I first came out in 1997, not to date myself, and I was a traditional family doctor, and I chose the West Coast because I wanted to be like the old-time doctor. I delivered babies. When the baby came out, I was the pediatrician who did the exam. I even followed those babies into the newborn nursery, the lower level, not a NICU, but before they went into, or the special care nursery before they needed to be on a ventilator. And then I followed my adults into the hospital, so treated them there. I assisted on their surgery. So I was really heavily involved. And slowly as medicine transitioned. So I did that for 6 years, and I knew I would do deliveries for 6 years, and then I knew I would get out because that sleep deprivation does take its toll. And I found that a lot of times here I am trying to have my own family, and every time it was the opportune time, I'm being called out on a delivery for someone else. I'm like, how is this going to happen? If I'm not available when I need to be available for my own family needs. And then medicine really segued to separating inpatient with hospitalist versus outpatient, and all those final layers went away. So then I gradually just kind of migrated to doing outpatient medicine. And ironically, when we were expats, I practiced traditional medicine there for part of the time, kind of got disenchanted with it. And then when I found functional medicine, I was studying it for maybe the last year that I was there and starting to apply it to some of the patients I saw there. And the reason you don't remember me as a doctor, because neither did my kids didn't know I was a doctor either, because I was off for 4 years. And when I told our 4-year-old, I said, well, today, we had a nanny, like everyone has a nanny. I said, me and the nanny are going to take you and Liam to school. The nanny's going to take me to work, and then she's going to come get you, and then she's going to come get me. So I was only working while she was in her little preschool. And when I said I'm a doctor, she's like, you are? And she had no idea. And she
have a job? She have a life other than me?
She introduced me to all her friends as, hey, I want you to meet my mom, Dr. Rajka. She even referred to me this way. It was so funny.
She's proud of you already. I love it.
Yeah. So getting back to kind of just the original question. So then I found functional medicine, started applying it abroad, and out of the blue, I thought we wanted to go back to the United States to establish a home base. And I typed in functional medicine, physician positions, and I found the perfect job for me, a job that would train me every day. And so there's a doctor who had a practice, and he would train me every day on every case for 3 months. And that's huge because there are no residencies in functional medicine. So that was that.
Okay.
Yeah.
Okay. Wow, that's a great journey. I love it. Now, it sounds like you have a mentor of some sort. And do you mentor as well? So tell me what that looks like.
Yeah, so first to answer your question on, do I have a mentor? So the first, I've had many mentors along the way. Teachers were probably my greatest mentors from elementary to junior high and high school. I always remember ones that made the biggest impact. And then, of course, in residency, there were ones that really stood out. But that clinical mentor in functional medicine, his name's Ed Levitan. God bless him, because he really did such a great service, and I'm forever indebted because it's made me who I am. He was a clinical mentor, and then when I launched, we moved yet again. So we were in Boston for a couple of years, and for family reasons, now we are right outside of Chicago. And I launched my own practice and did it alone for a couple of years. And I finally said, I need help, because you get to the point where you're like going to throw in the towel because nothing's working. Because the old adage, build it and they'll come, is not true. It rarely just happens magically. People don't tell you that. And so I did find a mentor, and that's where I was able to take it from this really measly business to, a 6-figure practice. It was very quick. So the importance to your listeners is that it takes you, in 6 weeks, it took me what this person learned in 6 years. So I was able to expedite. So you bypass it. So in turn, I do mentor in 2 capacities. So one is on the clinical aspect. So I do mentor other practitioners on functional medicine, because it isn't so intuitive to apply. You have to kind of have you have to be mentored a little bit, and then it becomes more intuitive, just to get you started. And then periodically is check-ins, and I certainly am part of a wide variety of groups, and maintain a clinical mentor who's now 70, who's had 40 years of experience over my 23 in medicine. So it's huge. And I also mentor from a high performance capacity as well as business. So I really, I want to give back to, what I was able to gain from others.
Fabulous. So do you mind talking about COVID a bit? I know that is a conversation everybody is talking about, and there's no way to really get around it. But really, from the functional medical perspective, what do you think about COVID, underlying issues, and where we're going kind of moving forward? I mean, what do you see from a medical perspective?
I love that you asked me this question. I think the conversation has been completely missed by the whole world. Everyone is focused on, oh my gosh, am I going to die from it? Rather than, let's look at the data. So I can't tell you with any reassurance whether asymptomatic people can spread it or not, because on Monday of this week, the WHO leading doctor said it's rare. And then on Tuesday, Dr. Fauci said, no way, it's very possible. So the experts can't agree. But what I can tell you is I can't tell you how to prevent COVID, but I can tell you how to optimize your own immune system. And how to reverse the diseases that have gotten people into the bad outcomes that we're seeing. So the thing to note is the majority of people dying, had almost 80%, had underlying medical conditions. And the other 20%, I bet you, and if you've watched my series, The Labs Your Doctor Probably Never Ordered, I talk about that, and I talk about the 4 words your doctor should never say: your labs are normal. I bet you that 20% had significant nutrient deficiencies, had significant immune dysfunction that just has not manifested in disease. So the best thing I know to do, and I think all of us should be focused on, is how can I make sure that if I'm diabetic, to bring myself out of that diabetic state. If I have heart disease, how can I optimize my blood pressure without medicines? And if I don't have any of these symptoms, and I would welcome all of your listeners. So even if you feel well, what I've found is that most people acclimate to a much lower level of energy, and that's the first thing that goes out the door and is a red flag. And once it's restored, they say, wow, I forgot what it was like to feel so good. And this is coming from 20-year-olds. So it's not just my patients who are aging and midlife or seniors. It's coming from even the young folks that see me. So I think the focus going forward is, how do I optimize my immune system by the foods I eat, the choices I make in my lifestyle, how I sleep, what I do to regulate my stress, and so on and so forth. And that's a conversation that should be happening.
And I think that's really hard right now, because I think people are very overwhelmed with just life in general and just the new way of handling COVID and the quarantining. So how would one know if they had a low immune system?
Well, so I do markers. one of the things you should be really worried about is if you have a family member who has autoimmune disease, then you're genetically set up. And, you know, we look at nutrients that need to be present in optimal amounts so that your body can recognize foreign from an invader. And some of those key ones are vitamin D, and 100% of the population is either deficient or insufficient. So
Right.
let me say that again. If you're not taking vitamin D, very likely you're low or you're completely deficient in it. And so that's one. And zinc, interestingly enough, helps regulate our immune systems as well as vitamin A. And so these are the things I actually would measure, these nutrient levels in someone's blood, and then be able to say, hey, let's optimize them while we fix your diet and your lifestyle to ensure, because unfortunately when you're stressed, stress actually chews up some of these vital vitamins and minerals much more quickly, particularly magnesium, which makes us calm and prevents your muscles from cramping, etc. So
yeah, I hear, I mean, I'm listening to you, and I can kind of tick boxes on, you know, what I know from my own body, and, you know, all the other things that I've learned about medicine, and just even the African American community that are really struggling with vitamin D and with the COVID. I can see the connection there as well, because many of us feel that we don't need vitamin D. So I think that everything that you're saying is kind of really, you know, coming together, and it's nice to hear you unpack it right here for full understanding. Well, I'm gonna pivot a little bit, and I want to talk about you. And you've got, I want to make sure I'm going to say it properly, the High Performance Doctor for Busy, Motivated Women. I'm very interested. I've been tuned in, if you haven't seen me yet. But can you tell everyone what that is about? I want to really expose this. I think this is really good.
okay. So first, let me talk about what led me to high performance. And it was really by virtue of, I felt like I needed to do an even better job in influencing people to actually take action on their health. And because what I was seeing was, as I got better and better in the field of functional medicine, I was seeing sicker and sicker patients, that they would come to me so far gone, it was too late. So there's a period of time where you go to past the point of no return. And it's heartbreaking to have to listen to family members cry about maybe their loved one's not going to be around. And I said, I need to learn how to influence. So the initial impetus was to do a better job for my patients. And I chose high performance coaching, overall coaching, because it really, what that means is a sustained level of success consistently over time, that it does not sacrifice quality of life or your health. And so that was really important to me. So it's a sustained level of success and performance consistently over time, which does not sacrifice quality of life or health. And I think as an entrepreneur now, one of the things that happens is you could be working 24/7 and you can work yourself into the ground.
Yeah. Yeah. And so many of us moms, not just, I'll say women as well, but I feel like motherhood really affects that, because it's a nonstop. You're doing 2 and 3 things at one time. And not to discount women without children at all. Because even when we're women and we're without children, we feel like we can do more. And so we push ourselves a little bit more there. And I see that your focus is women. So are men invited?
The men are invited. They're actually invited in my clinic, and I've been asked, I may have to launch a separate group for them, because what happens is I treat the moms, or even from a performance standpoint, I treat the moms and the sisters and the aunts, and the men just gradually catch on. They see the results, and that's what they come in. And the funny thing was, when I announced that, even named my programs in the clinic after she, it was signature she and executive she, and she was in it, more men started to flock to me. I don't know why that is.
They're there to see the ladies. I love it. But once you kind of, there's their saying, once you fix the mom, then everything else kind of trickles down, right? Is that how it works? A healthier mom means a healthier husband, means healthier children, etc. And then mom gets healthier because, she is healthy. So
Yeah, so I'd love to speak to that. So my whole branding is around this concept, and my vision of a radiantly she woman is one that's been empowered with the knowledge to actually live optimally well, to improve all facets of her life, and in turn empower her tribes. And I'm passionate about women because I think we are the backbones of our tribes in society. So whether you're whether you're a mother, a business owner, you're going to encounter women's in the workplace, at the park, if you're a mom, that you can influence with your knowledge. And I'm only one person, but if I teach one person and they teach 5 others, like, hey, I was a doctor and this one tip really helped me become better. And so that's my vision for the Radiantly She Woman, is this empowerment that you just talked about. I love it.
No, yeah. And I've tuned into your podcast at the end, or I would say your postings, not necessarily a podcast, but I have tuned in, and we'll make sure that everyone kind of has all your information at the end, so they can tune in as well. I really appreciated your videos about what your doctor is not saying about your labs, just because, I've had some issues in that, and I know we'll talk about that another time, but I thought that was really great. I'm definitely paying attention to those. So why don't you tell me about any tips that women can have, these busy ladies that are not necessarily, unhealthy, everything's normal, so to speak. They've been tested, they've seen you before. How do they maintain this success, this busyness, and this healthiness, and just this myriad of all 3?
Yeah. So what I would say is, if I had to give only 3 tips, because only 3, I'd say the ones that have the most impact are, if I could tell everyone just to eat whole foods, just give them all the process, if you could sustain that. And the easy tip behind that is, you either have a schedule to prep on the weekends, or if you're so busy, you pay someone to prep for you, that you can easily, at the minimum rate. There's people dying to work now with COVID-19, and everyone's out of jobs. And even so, there's so many different platforms to find people, and word of mouth in your neighborhood communities and your mom's groups. There's someone that loves doing that if you hate it or don't have the time. The second tip would be, the emphasis should be on sleep. Sleep should be sexy, and you should schedule it, and you should be in bed by 10 and not burning the midnight oil, because if you're not, that's the way our body detoxifies, and that's where we get into trouble. And that's where we refresh and rejuvenate. And if you're having trouble, jump onto my Facebook page, or I have several different groups running, and I share all the nitty-gritty tips, and really to focus on that. So if you're not waking up refreshed, then you have some work to do, and you're not going to be your best self for the long term, and you are going to be inflamed, because when you sleep, it puts you into an inflammatory state, and that makes you fight off infection and all the other things less well. And the third tip would be to carve out time for what I say white noise and creative space. And so that could be in the picture of self-care. And so my husband was talking, and we just decided Sundays are definitely going to be no media, no work, nothing, strictly for the family. And we had it built in, and it can get away from you, as you need probably a full day, and then little bits each day to honor and respect your need for self-care. And self-care is not selfish. So if you can't take care of yourself, you can't take care of your loved ones. And right on my website is a little video that says, Mom, put your oxygen mask on first. And it really talks about the story of how I got into so much trouble from a health perspective by not, in my case, it was mostly A, not taking the time, but B, really not knowing what would have helped me through those times and gotten me over the hump of some of these issues. So
I like that. Thanks for those tips. Now, we see, the Dr. Rajka after, medical school and all the drivenness and all this. I mean, are there any pitfalls or plateaus? And how did you handle it? And because everyone kind of sees you at your greatness. And I feel like this is what happens, especially for the generations behind us, the millennials and the Gen Zers, when they just see people in their blossom, not necessarily on their way up the mountain. So can you tell us a little bit about any type, in a story or just in general, how you handled any type of career hiccups?
Yeah, so let's talk about those hiccups. So people don't tell you, build it, then they'll come.
That's right. That's
they
right.
they don't always necessarily come, and you really need to be laser focused and be very clear on the outcomes you want. But then, the first thing, so I hit a lull where I'm like, I'm putting in 100 hours a week, and I'm at a break even for 2 years. So the outcome was, I said, I need to find someone to help me. And that's when I found my first mentor. And then things before COVID were really plugging along. And I said, wow, because every business, people don't tell you that you're probably at a break even for 3 years or 4 before you can start taking money back out. And I was right at that turning point of where, wow, like all my efforts through my networks, I was getting referrals left and right, current patients, other practitioners who knew my work, training societies I had trained with, you name it. And I just couldn't keep up. We were starting to hire, and it comes to a screeching halt. And what people don't tell you, like you said, they don't tell you that I was okay for 2 weeks, and then you just have to let your feelings come out. You gotta feel the feel. And it was walking and crying for a couple, 3, 4, 5 days, and then regrouping with my tribe to say, all right, we all have this in us. And so that's why I've always wanted to have freedom of location, and it's just happening a little sooner. And I've always wanted to amplify my reach. So I launched a challenge that was meeting everyone's needs. It was the COVID-15 5-pound challenge. Everyone gained 15 pounds, or that's what they were telling me. And it was really me. So they're worried about weight. I'm not worried about weight. I'm worried about, I don't want people getting COVID and dying from it. And I don't want them coming to my office when they have full-blown dementia. I want to see them when they already feel well and make them even better. And so it was pivoting and restructuring. It was relying on all my network, all my resources, and people don't tell you. And there were so many times I almost threw in that towel, and it was digging deep inside. And even, what happened was, to speak to the high performance a bit, was Brendan Burchard is the face behind that high performance training. And every year you have the right to recertify. And I think it's powerful. And when you're recertifying, you actually coach others. And while you're doing it, and then you're coach. And I was able to get very crystal clear on where I was going. And it was like that light bulb went on, like, okay, I'm not in a fear state anymore, a fear and scarcity. And oh my gosh, what happens next? And I've just been on fire, and that's what I feel. And it shows, like, even in that group, people are like, oh, what did you love? And they're like, we love the lives. And I'm like, we love the lives because I'm living my true purpose, and I'm in my element. And that's what I'd love to impart on others. So that's why I say, come join me, because I'm a go-giver. I like sharing this, and the energy rubs off on everyone around you.
Yeah, I can tell. I can see your energy and feel your energy when I watch your videos, and when you do your live videos. And so I love it. I appreciate all of the information, seriously. So let's, because you are a functional doctor, does that mean you accept normal insurance and you're on a normal list, and people can, tick you from their Aetna plan or their Blue Cross Shield plan? Like, how does this all work?
Yeah, great question. And I love that you bring it up, because it's the most common one that comes through. So let me, for just a minute, talk about, not even a minute, but just a few seconds, talk about the process. The process is such that when someone comes to see me, we decide whether it's a good fit, because if it's not a good fit, then I can't help you. If you're bound to determine that I'm not a good fit for you, or vice versa, it's not going to work. It's a collaborative relationship. Once it's a good fit and someone works with me, they fill out a 26-page questionnaire, and it looks at every aspect of their life to delineate the triggers. So you said, how do I know if someone's deplete? I take a very detailed history that points to the causes. Then I get clear on that history when someone's talking to me, because I'll tell you, even though it's 26 pages, people leave things off that are really important. Like one time a gentleman came in and said, was it important for me to tell you I had malaria twice as a child? And I'm like, yes. And so they just forget our lives are so varied and deep. There's so many details, you leave them off. And then I do an exam, because I'm a medical doctor, and then we formulate a plan. It becomes very quickly. And if people are on board, and the more buy-in I have, and they're able to implement even little bits of what I say, we're off to the races. The symptoms score drops to more than half within 4 weeks. They are on their way. It's very quick if people are motivated and even take some of the action. So, and I built it around where I have a coach to help coach. Now I can help from the medical standpoint, but it's so labor. I prefer coaching on the business standpoint, and that's what I probably do best. And so I have a coach that I work with side by side. And together, the two of us, we took a burnt out executive from on the couch, disabled from fatigue for 18 months to launching his own business and living in purpose in 10 weeks. So he went to 100% energy and launching his own business. So that's huge. Like by the 8-week mark, he was about 80%. And then between that mark and the next one, he was off and running. And so I've actually had to send a little reminder and say, hey, I know you feel great. See me once a year. So my real goal is to see anyone. So to get back to the insurance, it's like, it's labor intensive. And so no, unfortunately, I provide super bills and then allows you to bill it back through your insurance. So it is many, and it's because of the time involved. There is no medical insurance that would pay me for a fraction of the time that's put in to get someone. And I always tell people, well, question, what is your health worth? Like, what if I could restore your health in 3 to 6 months and you don't go on to develop MS, or you don't go on to develop dementia like a parent of yours had, or all your joint pains go away and you can get on the floor with your kids because you don't have whatever arthritis symptoms were bothering you. So people really have to dive in, and there's so many ways people spend money. You have to take a value of where are you spending your money and what is important to you. And I can't tell anyone that. Once they kind of see that, and it's like, this is one and done, fix you now for the rest of your life. So that's what
when you feel better, you do better. So that's I believe in that and that mantra. Well, do you accept virtual appointments?
I do the virtual. So I have launched, right now I have a group coaching program. It's an educational program, and it's an 8-week program targeted at women, my favorite demographic. It's called the Radiant Reset, that takes people, it really balances people's energy, hormone, and weight. And so very successful. Everyone's worried about the weight, which I can get them. I've studied it and worked in weight loss for the whole time I've been out, actually ever since residency. So since 1994, and that's a long history in it. And have really fine-tuned it to where, and then on the back end, what I do is I teach everything I do in the office through this program, so that you're essentially getting everything I do in the office, and it's just virtual and online. And that'll be expanding, so we can target even more.
Especially in this climate, where everything is virtual. Right? So how would you handle the 26-page document and your medical exam if I live in Houston and you're there?
26-page form. I teach you how to look for the clues. So we kind of do remove that, and that will be a subsequent program to the 8-week program. Really restores balance very quickly. And then if people want to do a deeper dive, it would be me teaching you to identify your own triggers. So
I see. Okay. Well, that sounds great. Well, listen, we're going to make sure everyone has all your information about your practice and how to reach you and all your social media platforms. And I really appreciate you really supporting what I'm trying to do here. I'm in support of everyone's career and making sure that they are living their purpose and doing all the things that they want to do. And that's my goal, is to highlight individuals that are already doing great in their career and sharing how that it came to be. And so I appreciate your time and also your medical opinion and your advice today.
Oh, well, thank you for having me
on. Thank you. This was so great. I really enjoyed everything that you said, and I'll be talking to you just personally.
Anytime. I'm here for you.
Thanks so much, Dr. Rajka. Have a good one, okay?
Thanks. Bye-bye.
Tell Liv I said hi, and I'll tell Mason that I spoke to you.
Sounds good. I will.
You guys take care. Bye-bye.
Bye.